Our next presenter for today is Dr. Josh Mandel. Dr. Mandel is a physician and software engineer working to fuel an ecosystem of health apps with access to clinical and research data. As chief architect for Microsoft Healthcare, chief architect for Smart Health IT, and lecturer at the Harvard Medical School Department of Biomedical Informatics, Josh works closely with the standards development community to lay the groundwork for frictionless data access, authorization, analytics, and app integration. He led the development of the SMART specification and launched the Clinical Decision Support Hooks project. As a member of the National Health IT Standards Committee, Josh has a special interest in tools and interfaces that support software developers who are new to the health domain. Josh, I'll turn it over to you.
Thanks. And what I want to spend a few minutes to talk about today is security and privacy of information in the context of consumer-driven sharing of vaccine credentials. I should know just at the beginning that security and privacy are also very tightly interwoven with many of the other properties of these systems, like data quality, for example, particularly for systems that are using some of the data that are stored in an immunization information system or a health record system as part of authenticating patients. So there's often crosstalk between these different domains. But I'm going to focus on a few very specific questions around privacy and security to get started. And I hope we might have a chance to explore other topics of interest when we've got time for questions from the group. So the questions I want to start with today are, number one, on the security front, how do we make sure that we can give individuals access to their own data and make sure that they can't get access to data they're not supposed to see? So the very basic questions of access control in a world of consumer access and consumer-mediated sharing. Next question I'll talk about a little bit is a privacy question. How do we make sure that people know what they're sharing when they choose to share data? How do we provide transparency around those decisions? And then the third question that I'll touch on is, how do we provide an ecosystem where people are responsible and empowered to decide when their data are shared, and they can be confident that they're not being tracked throughout this ecosystem and the data aren't being shared sort of between organizations behind their backs, so that they're part of the actual process of sharing data so that they've got that visibility. So I'll talk through each of these three, starting with the security point, which is giving individuals access to their own data. And I just want to say that we've been able to leverage a lot of amazing and important infrastructure from the US investment in health record systems. So as much as possible, we're trying to avoid building anything new when we think about giving consumers access to immunization records or lab test results in the context of vaccine credentials or travel. And we've got a lot to build on here because the US government has invested through the Office of the National Coordinator for Health IT and through these electronic health record certification programs. The US has invested a lot in creating consumer access channels. There's underlying laws and regulations that guarantee that consumers have a right to access their own information. And then there's a set of these certification programs and requirements so that, for example, as a patient, I can sign into a patient portal from a healthcare provider, from a pharmacy, from other organizations like a payer or an insurance company, and I can access my data online through channels that these organizations provide. And so when we think about building an infrastructure for giving consumers access to immunization data, the number one plan is just to build directly on top of that infrastructure, where healthcare providers are already on the hook for managing accounts. Every organization might have its own process for deciding how to set up an account, how to deal with things like a user forgot their password and they need to reset their account, or a parent needs to be authorized as a representative on a child's account. There is considerable complexity in that space, but this is also complexity that healthcare institutions understand how to work with and have been rolling out support for these solutions over the course of the last decade. And so everywhere we can, we build on that. And some of the most important data flows are coming from healthcare organizations, whether they're pharmacies. So for example, Walmart and CVS support smart health cards out of the box today, building on their existing consumer landing pages and portals. And there's a very similar story in the electronic health record world. So electronic health record systems like Epic and Cerner, and then hundreds of their customers, the healthcare providers and health systems, can turn on support for these standards as part of their existing investment in patient portals. One place where we're seeing some more data flow, and I'm excited to see it, has been from the information immunization the IISs, immunization information systems, generally at the state and jurisdiction level that Rebecca talked through. And the really important thing about those data flows is they can scale very nicely within a state. So we're seeing many IISs that have previously provided consumer access now building on the method they used previously for authenticating a patient and providing information. And they're simply layering standards on top. So the security story for these kinds of health cards is very much akin to the security story for healthcare data overall, with the same best practices and some of the same challenges as well. Let me say a couple things about privacy, particularly from the context of transparent data sharing. One of the principles for smart health cards, which is one of the standards that I've worked on for giving consumers access to these data, has been that anytime an individual is going to share information, it should be very clear what they're sharing. And they might be sharing it by displaying a QR code on the screen of a mobile phone, or they might be sharing it by displaying a sheet of paper with a QR code printed on it. But anytime they're displaying that kind of information, there should be human readable text right next to that QR code that tells you all of the relevant information that will be shared. Not just kind of a summary or a human readable view of some of the information, but a direct view of what you're sharing. So that if you can read the set of text next to the QR code, you can be well assured that you know what you'll be sharing when someone scans the QR code. Now, that alone does not give you the ability to hold back certain data or share a subset of your data. That doesn't provide what we call selective disclosure, but it provides direct transparency about what is being shared. And this is one of the most important elements for building trust, because one of the easiest ways to lose trust in the privacy of your system is to overshare with no visibility. So people think they're sharing one set of data, but in fact, if you dig into what's happening under the hood, you'll realize that more is being shared. So we work very hard to avoid that situation. And some of that work is technical, but some of that work is also social. Things like providing reference designs so that when a pharmacy or a state immunization information system is designing the layout of one of these artifacts, they're thinking hard about exactly what information to include in the human readable section next to that QR code, and they've got clear guidance about how to do it. So that really helps promote transparency on that front. And then the last point that I want to touch on has to do with the privacy aspect of tracking people as they move throughout the world and the data flows. And so our focus for these kinds of immunization credentials is on giving an individual a copy of a record that is really their copy. They can get it, they can keep it, and they can share it when they want. And what this means is that, let's say I'm in a travel situation where I want to share access to immunization records with a travel destination or with an airline. The idea is I don't have to connect that travel destination or that airline back to a clinical provider or back to a pharmacy or back to a state IIS. Instead, I am directly part of that data flow. And so I know what's being shared because I'm sharing it right in the context of that workflow. There's not information moving back and forth between those entities in a way that I can't see. And again, that provides transparency, but also provides important protections from tracking. So for example, if I get a health card from a healthcare provider, so one of these immunization records, I want to know that each time I share that, each time I might use it in the context of travel, my healthcare provider does not need to be part of that loop. They don't need to be seeing everywhere that I go or the destinations that I'm traveling to. There's a clear separation on that front. And so using this method of consumer-mediated exchange is one of the really helpful tools in preventing that kind of tracking. It effectively means that there's a clear consumer-facing pathway to creating information flow, and we don't need to rely on organizations creating connections in a business-to-business fashion. So those are the main points I wanted to touch on in terms of security and privacy, and hopefully we'll have time to dig into those in more detail or other topics that are of interest where those intersect with some of the interoperability standards that you'll hear about next.